All right, welcome. Hope everyone is doing well. Today we are going to, in this video, we're going to talk about alternatives. Alternatives are sometimes a little tricky to understand. Often people can get the concept of antimicrobial, adaptogen. Sometimes when you ask someone to define alternative, it's a little vague. It's sort of like, well, I think it helps with detox, it does some stuff. But alternatives are one of the biggest classes of actions that we have. In fact, really the three main, just about every other action will fall under antimicrobial, adaptogen, or alterative. Today, we're going to talk about alternatives. Let's define it. There are a few different definitions, but they all do come together. Yes, an alternative is useful in detoxification and elimination. The most traditional definition of alternative is anything that helps restore function to a tissue. Usually the word there is tissue. It's not body. Often when we get broader, we start to talk about adaptogens, helping the body, helping the individual buffer stress, but alternatives are often more tissue specific, and they help restore function. They help restore vitality. One of the ways that I like to put the two kind of beside each other is adaptogens are useful in deficiency. When something has been depleted over a period of time through a whole host of reasons, adaptogens are used to help restore and rebuild the buffer that helps someone actually manage those stresses of life. Alternatives, so if we say adaptogens go with deficiency, alternatives pair with excess conditions, pair with conditions where exposure to some kind of toxin, and stress is a toxin, emotions, endogenous toxins, can also build up and decrease vitality over time, decrease the ability of a tissue or an organ to perform its function. Our alternatives help restore that function. They help, and usually they are toning, strengthening, and supporting elimination, detoxification, to help restore the function of that tissue. Now, there are a handful of herbs that certainly do both, and you can certainly put adaptogens and alternatives into the same formula. Often someone who is very weakened will also have some toxic accumulations and some tissues that are less than optimally performing. But as a simple way to understand it, think of adaptogens for deficiencies and alternatives for excesses, for clearing and nurturing. Sorry, not nurturing, that's adaptogens. For clearing and restoring. What we'll talk about today as we look at the alternatives is, much like we did with adaptogens a little while ago, how to differentiate between them and how to at least get an idea when to use which one. Many of them do have specificities to certain systems. Many of them can be used broadly as well, but the closer you can get to identifying, with a good assessment, identifying which systems or tissues or organs you most want to tone, the closer you can get to building an alternative formula that matches that. Here is our chart on alternatives. We're going to see two different parts of this. We're going to start with the green ones, which are our leafy alternatives, and then we're going to look at the roots, which tend to be a little bit deeper acting. But first, let's talk about our leafy alternatives. Now, it certainly doesn't mean you can't use the two together. You absolutely can. In many cases, we do. However, usually when we talk about our leafy and our aerial parts, they're acting via the kidneys. Now, one of the older definitions of alternative is a blood cleanser, a blood purifier. And certainly both the leafy and the rooty alternatives will do that, but more so the leafy alternatives will achieve that. And they achieve that because most of them help improve the filtration by the kidneys. Many of them are at least mild diuretics. At least one of them is a fairly strong diuretic. And that helps elimination. Anything that is a blood-borne substance that is eliminated via the kidneys will be facilitated by using some of our leafy alternatives. We'll go through just across the table here. First off is nettle leaf. Now this one is an excellent alternative. It's also a very good nutritive, and some would say the best way to get nettle is actually simply to eat it. Eat it like spinach. Cook it. It's not very good raw. It'll sting because it's stinging nettle. Don't want to eat it raw. But cook it or dry it. Add it into whatever food you want. It goes very well with rice. I've even had it in oatmeal once. And eat it as a nutritive. This is a wonderful way to get the nutrition out of it, but also to get that alterative benefit. However, it makes a wonderful tea. This is one of our nicest infusions. In fact, I would probably say there's really no need to ever use nettle leaf as a tincture because it makes such a great infusion. Put it in, let it sit 30 minutes, 40 minutes. You can leave it on low heat if you wish. And what you have on the other end, especially if you have good quality nettle to start with, is a really hearty, invigorating tea infusion. And you can tell, you can feel that it does help restore vitality to the body. It is a diuretic. It doesn't always class as a diuretic, but at least my experience with it, particularly when it's good quality nettle, is that it will act as a diuretic. An important thing to keep in mind, if you're going to be using a diuretic, anything that increases urine output does mean someone has to use the bathroom more often, and you do want to take that into consideration. However, more urine through means better filtration and better detoxification, elimination through the kidneys. Similarly, we have our dandelion leaf. Dandelion leaf is more diuretic than nettle, certainly, and it's probably about equally alterative to nettle. One of the differences is it doesn't taste quite as good. It can be very bitter, but likewise, when you get a good, properly harvested and dried infusion of dandelion leaf, is really quite nice. Little, as long as you like the taste of herbs, it's really quite nice. This one, probably paired often with nettle. These go quite well together. Another one we'll see in a moment is yarrow. Those ones also pair quite well together. Next on our list here is red clover. Red clover is an excellent alternative. Quite popular, less so now, but for a number of years quite popular as a source of phytoestrogens and was used to try to balance hormones. It's possible that the phytoestrogens play a real role there. It's also possible that the alterative properties of red clover are the reason why we actually saw and continue to see good results using red clover in treating acne. I would say if we were going to put a specific on this one, red clover is an excellent herb in acne in women that has some hormonal association. Is it related to the phytoestrogens? Maybe. Probably. Hard to say. Is it related to its ability to act as an alterative? Sure. That certainly helps. When we look now in the center here at our yarrow, our Achillea millifolia, sometimes millifolium, we've got our prototypical alterative. Yarrow, excellent alterative, bitter, but definitely toning. Probably more than the other ones we've seen so far. Start to get some of that bitterness, a little bit of astringency, toning the tissue, drawing it together. One of the energetic taglines of yarrow is, helps people keep it together, or helps keep people from falling apart. It's thought of as a knitting herb. And one of its most traditional uses was as a soldier's herb. Another one of its common names was soldier's herb. It's a vulnerary. That's a big part of the reason why it got that, but it's also an antimicrobial, and it's also drawing together. It would be packed topically into wounds. Almost everything that we use topically for wounds, particularly the vulneraries, can be used internally for the same reason. So yarrow is especially useful as an astringent to the GI. So if you've got weakness, stability of the stomach, the intestines, not so much the large intestine, but the small intestine, yarrow makes an excellent choice of an alternative there. Another one that's up here that isn't so popular, certainly anymore, is scrofularia. This is our figwort. This one's a pretty good alternative. We don't really even use the word alternative for the lungs too often, but this one came to us from a lot of use in treating tuberculosis. That's where it gets its name. And this one is nice for the skin, it's nice for the lungs, and it's nice for the bladder. This one particularly good in post-infection cleanup. We'll see some more of those in the Rooty alternatives, but when you've got swollen lymph nodes remaining, when you're still cleaning up after an infection, particularly if it's an upper respiratory tract or even a lower respiratory tract infection, our scrofularia makes a nice choice. In that same idea of immune system, we see our gallium apiarine. This is our cleavers. This one really classes as a lymphatic. Now what we could say is a lymphatic is really just an alternative more specific to the immune system, but this one we usually say is a lymphatic. This one specifically used when we've got swollen lymph nodes, active or post-infection, and we want to help clear, move, drain the lymphatic system. Our phytolacca, not mentioned here, but much stronger than that, also classes as a lymphatic or an alternative for the lymph system. Lastly, on our top list here of our leafy alteratives, we've got our verbena, our vervain. This is a nice herb. This is a bitter herb for sure, but it is probably the strongest alternative that we see in our leafy alternatives. It also has a long history of use as a ceremonial herb. It's very much thought of as a woman's herb. The image or the energetic image that comes with this is the strong woman asserting, bringing it together, collecting, and being a powerful force. And we see this in a lot of the older traditions where vervain was used very much to that effect. Often, vervain is to women as yarrow is to men. If yarrow is the soldier's herb that helps that hardiness and that strength, vervain is the woman's herb that helps that same strength and assertion. Also good as a nervine, and particularly useful, I think, for the GI and the digestion. So now let's look at our rooty alternatives. And again, this is a way of sorting them, but it's certainly not a fixed way of sorting them. It's just a way of beginning a classification so that we can later put it all back together. Here are the rooty alternatives, and we can say these act primarily via the liver, in the same way that we can say that the leafy ones act primarily via the kidneys, but certainly there's overlap in those actions. These ones, though, I would say are stronger. They will promote a larger effect. You'll see more change probably sooner in using the rooty alternatives. If we were to talk about a case of congestion of the liver, these are the herbs that we would favor here. Starting first with our iris versicolor, our blue flag. This one is often thought of as an endocrine lymphatic. It shows up as endocrine modulator, and for a long time it was still somewhat held up to be an herb particular to the thyroid for restoring thyroid function, which still classes it very much as an alternative, improving the function of the tissue of the thyroid. Still used as such. We're not quite sure if it really acts directly on the thyroid, but we can say it does seem to improve metabolism, vitality, and function, so we use it similarly, even if that's not its exact mechanism of action. This one does seem to be a little more preferential for women. They'll certainly use it in a lot of men. It also seems to be particularly good for skin. You'll see this with a number of our alternatives in that they help the skin simply because the skin is the next stop as an organ of elimination, particularly after the liver. So if the liver is overburdened and not working as well as it could or wants to, if the liver can want things, the skin is one of the next places things show up. By decreasing the burden on the liver, we remove the burden on the skin, and when we remove the burden on the skin, we simply see a diminishment or resolution of those skin lesions and other things that happen on the skin. So we'll see with a number of our herbs, particularly the ones that focus on the liver, that they've got, as a system affinity, skin conditions. Iris certainly among them, possibly even one of the best for skin conditions. However, a rival for that title is our Oregon grape, our Mahonia aquifolium, sometimes called Berberis aquifolium, and you can guess from being sometimes classed as a berberis, it has antimicrobial properties as well. This one, great for the skin, also particularly useful for post-infection cleanup. If you're seeing challenges with the skin, secondary to or after an infection, or if you've just got a regular infection, this is a nice herb to include as part of your formula. It's not quite classed as a lymphatic, though I would say it's probably pretty close. Next to our Oregon grape, we've got our dandelion root. And if we were to say yarrow is kind of the prototypical leafy alternative, dandelion root and burdock root, dandelion root is our prototypical rooty alternative. It is actually not as bitter as most of the herbs that we use, but it's a very good hepatic. So hepatics really could be a subclass of alternative in that they are alternatives for the liver. Here we see particularly useful in helping clear things. If we want to think of the most classic detox herb, probably our dandelion root is one of the nicest ones to use there. It's a mild laxative, but it's not a stimulating laxative, and that's quite important. We're going to look at yellow dock. That one is a stimulating laxative, contains the anthraquinone glycosides. Both dandelion root and burdock root do not. They are laxative, and if you take them over a period of time, they will loosen stools, absolutely, but they won't create accidents or emergencies. Often what we want is that exact effect. In a lot of cases where you've got hepatic congestion, you've also got constipation. You've got things not moving smoothly through the GI. In fact, that's probably another nice definition to tuck in there for alterative, especially our Rooty alteratives. When things are not moving smoothly, the alteratives help restore that smooth flow of function. There's our dandelion root. Beside it is probably my favorite alterative, and that's burdock. Burdock is not bitter. In fact, it's quite sweet and delicious. Where that is useful is in treating particularly conditions of the stomach. Anything that's sweet helps soothe the stomach, helps soothe the upper GI. So when there is stomach unsettlement, when there is disharmony in the stomach or just a sore stomach, burdock becomes probably our best alternative here. It sometimes classes as an adaptogen because it is nutritive. You can certainly eat it. I've roasted it before. It's fairly tasty. You can certainly eat it, and it will invigorate. It will feel hearty. So I think of this, it still classes as a hepatic, as it should, but I think of this often as more specific to the digestive system, especially the stomach. We do see it acting as a mild laxative, and the other kind of exciting and probably related, almost definitely related area that we see it is in treating diabetes, type 2 diabetes. It seems to show pretty good benefit in helping regulate blood sugar as part of a comprehensive plan, but if you want to think of herbs that are useful as alternatives for the endocrine system, particularly diabetes, burdock probably shows up as the number one. Smilax, or our sarsaparilla. This is an herb that classes both as an alternative and an adaptogen. This one, pretty great herb. This is our old-fashioned root beer, and the image still is of sort of the dusty cowboy, dusty cow person coming off of the range after a hard day's work and ordering a sarsaparilla tonic. Helps cleanse and restore that function. Now we do know that male or female, this is also a libido tonic. This one does support testosterone and will help, in fact, it's probably one of the best herbs for helping increase testosterone and increase libido. Nice herb, excellent decoction, pairs very well with a little bit of vanilla and a little bit of honey as a pleasant drink. And lastly, one that really doesn't show up a lot in Western botanical medicine, but very used very commonly in TCM, in traditional Chinese medicine, is our bupleurum, our chai hu. This one is probably our deepest acting liver alternative. This one is used for old stuff, be it emotional or physical or just buildup of toxins in the liver. This one goes pretty deep. It's not a laxative, but it will clear heat. If you've got toxic burden in the liver, the more you suspect toxic burden in the liver, the more you've got a pattern of inflammation, our bupleurum becomes one of the best herbs to use. If someone does have a cold pattern, if their constitution is cold, this is not a great herb to use. But the more you see that toxic heat kind of pattern, the more bupleurum becomes a primary in your formula. And we've got here on the bottom of this, we've got mild to stronger, superficial to deep. There's some value to looking at that, absolutely, but hold that lightly. Final thoughts on alternatives. You can absolutely mix alternatives from the Leafy and the Rooty. Now we've talked about just alternatives here, but truthfully, you will usually be pairing alternatives with other specific actions in your formula. You might choose alternative as your main action, but then you might say, okay, specifically, I want hepatic, and you focus there, but you say, you know what else? I want some adaptogen action, so you add in an adaptogen. Or I want some, depending on your case, I want some endocrine modulation, regulation. So alternatives are sometimes, absolutely, they are the entire formula, but often, like adaptogens, they are paired with other specific herbs for your individual presentation. What we've gone over today hopefully helps you start to differentiate when you may use one or the other or multiples in combination, but of course, just a guide. A good amount of it is opinion, although it comes from reasonable sources. So hold that lightly and begin to experiment for yourself. See how you do, see how you mix things up in practice, and of course, see how your patients do with your formula. So I hope that's been helpful. Good luck and happy formulating.